Okay, so welcome to the third of these short videos from Public Health England's Health and Justice team on how we're managing COVID-19 in prisons. We've already covered some topics around how we manage large outbreaks in prisons and some of the key principles that we're using at the moment with COVID-19. Last week, we looked at outbreak control team meetings as a tool and how those function in England. And this week, we're going to be looking at surveillance and data and how we use that to manage an outbreak. And I'm joined by two of my colleagues, Maciej and Alicia. Maciej, can I ask you to introduce yourself, if that's okay?
Yeah, sure. Hi, Sunita. Thanks for the invitation to do this. So my name is Maciej Czekarowski. I am the epidemiological scientist with the Health and Justice team. Have been in this position now for about 5 years, and so quite involved in the ongoing health and justice surveillance system that we have for infectious diseases across all secure and detained settings in England, as well as some in Wales, because it's the same prison estate.
Excellent, great, thanks, Maciej. And Alicia, can I come to you, please?
Oh, hi everyone, my name's Alicia Cooper. I'm a Programme Manager within the National Health and Justice team. I've largely for a number of years now been working on programmes and projects relating to substance misuse treatment in the criminal justice system and more specifically around the prisons. I have just recently joined Maciej in supporting the work around surveillance of COVID-19 cases in the prisons and other detained settings.
Great, thank you both. Thank you. And thanks for taking the time out to talk to me today as well, because I know you guys are really busy at the moment. And one of the things you've both been working on, as you said, is designing a surveillance system for COVID-19 in prisons. And Maciej, I just wondered whether you could tell us a little bit about what a surveillance system is, why it's important, and how it's used in managing an outbreak.
Sure. Thanks, Anita. It's always nice to take some time out. So in general, disease surveillance refers to the systematic collection, analysis, and interpretation of data from various sources. But it can be used as an early warning system for any potential public health threats. So, for example, increasing disease incidence within a prison or other secure and detained setting, as well as for monitoring and evaluating the effectiveness of any infection prevention and control measures that are put in place when an outbreak is detected or declared. And more widely, it can be used to inform public health policy planning, as well as in the evaluation and monitoring of any public health policies that may be introduced. So just to give you an example, during the ongoing COVID-19 pandemic and how we're using surveillance in prisons, we really collect information to provide a temporal and spatial picture of disease progression across the prison estate, as well as in individual settings. So this information helps us to inform public health action, specifically that taken by local health protection teams in the regions and healthcare teams, as well as management working within the individual settings themselves. So, questions that we try to answer using our surveillance database include things like, is COVID-19 transmission or is viral transmission increasing within the prison? Which specific wings or landings can be affected currently, or are most affected currently, and that provides us with some information as to where infection prevention and control measures should be targeted most specifically. We like to collect information regarding the type of patients that are affected. So we tend to disaggregate prisoner versus staff level data. We've seen from previous outbreaks that staff infection tends to follow the community curve. So that helps to inform measures like whether we should restrict cross-deployment of staff, etc. And so in general, this information helps us to inform the type of infection prevention and control measures that we implement, and essentially for how long those measures should stay in place, and whether they're having an impact on infection prevention and control.
Great, thank you. And it sounds like it's so important to get that data, beyond that kind of operational data that perhaps we're all used to collecting. And it's really interesting that you talked about, data that was about who was being affected, so which prisoners, but also where they were living in the prison. So you talked about the wings and the landings, and those are locations in prisons. And so that can help drive some of the control measures. So thanks for that. So it sounds like that there is quite a lot of information that you need to collect for that kind of decision making. Can you tell us a little bit about the key pieces of data that you're collecting at the moment and why you're doing that?
Yeah, happy to do so. So during the ongoing pandemic, we want to have a clear picture of the burden of disease in service users, so prisoners as well as staff, and that includes healthcare and custodial staff members working in prisons and other secure and detained settings, as well as some information on disease progression over time. And so we clumped that into sort of the epidemiological, or the epi data that we as the National Health and Justice Team collect specifically. So that includes things that are bulleted on the slide there, including patient level data on a daily basis, which we map on things like an epi curve, for example. But that includes new possible and confirmed cases, so laboratory confirmed cases of COVID-19, as well as any deaths that may arise. We also try to get some information on how many patients are being hospitalized. So that's a good proxy sort of for the severity of disease and its impact in the prison, and has implications on prison operations, because any individuals who are hospitalized have to be escorted, and bed watch has to be organized as well. And then aside to the epi data that I mentioned, there's also operational data that can be useful as well, which is collected more by the National Health Service as well as the prison service. So things, in general, outbreaks can have a very significant impact on prison operations, but nonetheless, these establishments have to remain open as they serve the courts. So having this type of intelligence can inform, contingency planning, which is very important. So that data includes things like information about any regime restrictions, so whether receptions are ongoing, transfers from other prisons are being undertaken, whether court appointments are going ahead, and things like I mentioned already before, and you touched on again, wing isolations, etc. And that informs, whether essentially informs population management, so whether individuals should be diverted to other prisons or movement should be stopped in general. Other information can include things like prison staffing levels and prisoner and staff, or the proportion of prisoners and staff that are being isolated as a result of COVID-19. So that informs things like spare capacity within the prison, and whether a decent and safe regime can continue to take place.
Thanks, Maciej. And I think Suzanne and Mattia last week, they touched on the kind of data that comes to an OCT, to an outbreak control team meeting. And obviously this is the kind of stuff that they were talking about too. So that's great. One of the reflections that I've had from some of our international colleagues has been, how are you guys getting all this data? How do you know all of this stuff that's going on? And Alicia, I wondered whether you'd be able to talk us through a little bit about how we're collecting this data and receiving it.
Sure. Before I just talk about what we are actually collecting and how we got to where we're at, I'll just give a quick overview of the reporting process normally. So a few years back, PHE produced a set of guidance for prison healthcare teams on reportable diseases to be notified to our health protection teams, and this was recently updated, of course, to include COVID-19. So the document, which you probably see on the screen, is difficult to see, but there will be an attached document for you to look at later on. But it includes a flowchart of reporting requirements, and in the first instance, the prison healthcare team would notify when a new infection occurs. The prison healthcare team would notify the local health protection team of that new infection, and the health protection team would inform the National Health and Justice team and update the web-based surveillance and case management tool that PHE provides for all health protection teams. It's known as HP Zone. And what we wanted to do was to use the data from HP Zone for the surveillance work around COVID-19 cases, in prison specifically. But what we found is the data is largely qualitative in nature, not consistently recorded in a format that supports data analysis in the way that Matchley has just described around new cases, etc. But more importantly, the data is kind of variable quality across the piece. So instead, we've had to look at collecting data from a variety of sources, not discounting HP Zone, but factoring that in as well. But the variety of sources, some of those are received on a daily basis, and some of those on a more kind of ad hoc basis. We do have access to the daily NHS reporting on COVID monitoring that Matej alluded to. So that information is collected from the prison healthcare teams, but again, not in a way that's easily that we can easily use for epidemiological purposes. So it's largely been set up to meet operational needs and provides really a snapshot at a particular point in time around that. So for us, the key data source that we're using to kind of populate our monitoring is information coming from our national and regional health and justice colleagues. Most of that information is primarily obtained via the outbreak control meetings that you mentioned, Sunita. So we've, as a national team, produced a standard template to capture key information from those OCT meetings, and that includes data around new cases, possible cases confirmed, hospitalisations and deaths. And we obviously receive that information as those OCTs take place, where OCT meetings are not called, but there is still some level of kind of potential possible infections occurring. We receive data around those on kind of more of an ad hoc basis, mostly via email, but they'll be largely obtained from local health protection reports, local meetings that are being attended, other meetings and conversations that are being held locally, which the regional health and justice teams colleagues are involved in, but also things like prison line listings that are recorded by healthcare in prisons. So again, we get the data in from a variety of sources, and it is in a variable, as you would expect, a variable format and a variable quality. Then on a daily basis, what we do is we collect all of that data that we've received from all those sources, and we sense check that, going back to regional colleagues and national colleagues where we need to. And we transcribe the information into an Excel-based tracking tool, which captures all the information for each setting, prison or detention centre, in a consistent way. We transcribe the data. Transcribing the data is quite a manual process, as you probably can gather, given the different data feeds that we receive. But it has enabled us to form a regional and a national picture of COVID cases to date.
That's great, Alicia, and it's really interesting, isn't it? Because I mean, for a start, we're very fortunate that we have such a robust surveillance system in prisons. When we think about, some other countries that are still developing, their data collection from prisons around prison health. And so that's great. But it's interesting that you've reflected that actually that's not, the be all and end all of getting data. And actually you're using lots of different sources. And essentially it's about those, relationships that we've got with people locally to be able to feed that data nationally, and how important that is. So, I think there's a great bit of learning there, that even if you don't have, a surveillance system already set up, there are different ways of doing it that will, still give you that information as well. So that's great. Thank you. And so, we're gathering all this information together, and obviously, I guess that's used in reports and, in meetings and things like that. But are you guys doing something around how you're reporting back on that data? I know I've seen in other meetings that we've had together where you've done some graphical, representation of the data. Matje, would you be able to talk us through what you've been doing around that?
Yeah, happy to do so. So I think, the fact that our team is working in a public health agency, that really provides us with a unique perspective on the health of people that are living and working in prisons. And that that's directly informed by the surveillance data that we collect, and subsequently has an impact on the health policy in these settings that we're involved in planning and monitoring. So during the COVID-19 pandemic, we're producing daily situational reports that are shared with stakeholders across health and justice organizations in the UK, primarily in England. So, for example, the National Health Service, the Prison Service, as well as the Ministry of Justice, and those are all informed by the surveillance data that we've been discussing today. Essentially, what these consist of are a regional breakdown of COVID-19 cases in service users. And mainly we've been focused on service user just because the data has been more easily obtainable. And it also includes information about the number of outbreaks as well as the number of outbreak control team meetings that have been convened to date. And then we like to map the disease progression across the prison estate using sort of more graphical depictions of the data that are more easily to interpret. So that's where we like to present epicurves, which generally show the frequency of new cases against the date of disease onset.
That's great, Matje. And I think this next slide that we've got, kind of looks at the data over time, rather than the cumulative frequency of that. And what's really interesting looking at that has been that you've started thinking about when certain control measures were put in as well. And then I guess that then leads on to this thinking about what's the impact of that control measure being. Are we in a position to, change our control measures, and that kind of decision making?
Sure. And if we could just jump back to the first curve, the one that's depicted as a histogram. This is generally what is considered a epicurve in the traditional sense, with new cases sort of plotted over time. For the COVID outbreak. And you can see that, although outbreaks are still ongoing, their frequency is reducing, and the number of new cases reported over time. And that includes, possible and probable cases as well as confirmed cases and any deaths and hospitalizations. But there appears to be, a decrease in over time, indicating that the epidemic is being contained effectively in the prison estate as a whole. But you'll find in this particular graph, the way that things are depicted, there are still gaps on certain days where the data was not received. So likely those were weekends. And this type of curve, the way that it's depicted here is impacted by the timeliness and the capacity of reporting staff to get back to us. So the second one that you were showing is sort of a smoothed epicurve using a 7-day moving average of the same data. So the number of cases that were reported to us on a daily basis for the COVID-19 response. And so you can see there that following an initial upsurge in cases between mid-March and end of March, there was a falling off of cases, especially among the prison population towards the end of March and early April. And some of this likely resulted from, as you were mentioning, some of our work to tailor community public health initiatives to the secure and detained estate. And I think that some of the public health impact of that work can be seen in this type of graphical depiction, this type of smoothed epicurve. So you'll see there are a couple dashed lines there indicating when specific government measures were introduced to curb COVID-19 in the community. So on March 23rd, the government introduced community social distancing and isolation measures. And these were subsequently adapted by ourselves with, working together with the MOJ and the prison service to sort of prisonify them, to make them more generalizable to the prison estate. And the first ones included restrictions on regime and single cell accommodation. So that aligned with the social distancing and isolation measures that were put in place. And then that was followed a week later by transfer restrictions as well as compartmentalization setups within prisons to sort of separate vulnerable individuals as well as infected people from the rest of the population. And so as you can see, following the implementation of those measures at those time points, the graph sort of declined. So it led to this reduction in the number of new cases infected by each subsequent case, something that we refer to as R naught. And we see this, spike and then a sudden drop off following the implementation of some of those measures. So I think it's a good graphical depiction of how such surveillance data can be used to inform and monitor measures in prisons at the national level.
That's great, Maciej. A really good explanation, and it just shows that the power of data and how it can inform that decision making. I mean, it sounds like quite, I guess, a complex exercise for people to think about how, they can collate this data, develop a surveillance system. And I'd like to ask both of you, actually, if you had to give your top tips to someone who was doing this work, what would those be?
Should I go ahead then, Sunita?
Yeah, please, Maciej, you go first.
Yes.
Yeah.
So I think, if I was to give one tip, I think, as part of early planning, there needs to be sort of an integrated approach by all partners. So we found that we were sort of blindsided a little bit by this pandemic, as everybody was, but existing sort of surveillance processes were just overwhelmed. And I think to get, sort of an integrated picture, a consolidated picture with a lot more granularity, it's important that, not only health partners are involved in surveillance, but also justice partners. So colleagues in the MOJ and the prison service for that operational data, and consolidating epidemiological as well as operational data will give you the most complete picture of what's really going on and how the COVID-19 pandemic is affecting the prison estate. I think it will also reduce the burden on prison healthcare staff and health protection teams in the regions who have to provide this information and have just been found really inundated with requests for data. So there's a lot of, there's definitely a need for this information, but just the resources sometimes and capacity are not there. So I think we're seeing that trends and impact assessments are in general agreement across all organizations collecting data, but there are some data differences due to varying reporting intervals, different coverage of data collection processes, and even data sources. So having plans in place together with all stakeholders involved on how we could produce sort of this consolidated pandemic common recognized information picture, which is something that we're developing now, is really the way to go forward.
That's great. So partnerships are really important, but it sounds like being pragmatic as well as to what you can collect and how you can collect it as well. Alicia, what about you? What do you think?
I think just building on what Maciej was saying around resources, really, for us, I think we've had some resource in the national team, but we very much relied on our regional colleagues to support us and other members of the national team to support the kind of data collection, really, as I described a bit earlier. I think that without those kind of regional feeds, which come from the local information, feeding up to them and then feeding into us, we would really struggle to undertake this national surveillance work. And so I think that where there's no kind of clear surveillance systems already in place, then you do need to kind of think around what support and infrastructure is there, and what, as Maciej said, what partnerships can do to what partners can do to facilitate the collection.
Great, thank you. Well, I just want to say thank you to both of you for taking part in today's session. I know you guys are ultra busy, so really appreciate just taking this time out and really talking about your day jobs, what you're doing at the moment. So that's great. Thank you.
Thanks, Anita.
Thanks, Anita.